Thank you. Um, so the idea behind this space is really to facilitate a space for peer learning. So it's an open space for discussion. So every month we come up with a topic, then we then there's a suggested article that guides the conversation, but the conversation is not really restricted to the article. But so we do encourage everyone to share your thoughts and expertise around the topic. And in the last few minutes, we also then have a call for recommendations for the next topic discussion. So we hope this is an opportunity not only to gain more knowledge and capacity about the project, but also to get ideas on some of the work that's being done in different parts of the regions represented here, and also explore opportunities for collaboration. So it's always so encourage everyone as much as possible to share some of the work that is related to the topic. So I'll just quickly give an overview of the article that we suggested for this month. So this topic, last month we talked about zoonosis and climate change, and the recommendations from the participants from last month was for us to talk about One Health and food security. So the topic, the the article that sort of guided the conversation is this article around food security uh, and the ultimate One Health challenge. So basically, a quick overview of the article. The article highlighted that one of the key challenges that we are facing is a rapid increase in human population over time. And as you know, in Africa, we expect to continue having an increase in population and our population to double by 2050. And this in the background of really rising food insecurity due to multiple factors, climate change, over reliance on a few sources of animal protein. I think in most countries, these are the main sources of animal protein that people are dependent on, um, which include poultry, pig, beef, and sheep and goat. Then it's also worthwhile to really, when I was reading that, it's also worthwhile to really think about also some of the impact of this over reliance even on emissions and climate change and some of the recommendations around uh, uh, the dietary, more environmentally friendly dietary options. Then some of the other factors that were mentioned in the article uh, um, around the threat to food security, particularly focusing on animal protein, was the emergence of transboundary animal disease. And they cited an example of how rinderpest affected cattle and buffalo, causing so many deaths of human deaths in Tanzania and Ethiopia due to starvation. And I think right now we're really thinking a lot about the increased connectivity and movements of people and the implications of that in terms of transboundary animal diseases and also human disease. Then the article also talked about endemic diseases that are also posing a threat to animal production, uh, mentioning around foot and mouth and lumpy skin disease affecting cows, pathogen, then the avian influenza affecting poultry and also the African swine fever affecting pigs. Um, then also touched on emergence of zoonotic disease, which is a topic that we discussed last week. And as you know, zoonotic disease also affect both humans and animals. So they also have an implication, particularly on animal protein. So some of the recommendations that are there that they had in the article, which was in the article really they had a narrow focus around animal protein, where around really improving diagnostic tests, integration of human and animal surveillance, in terms of then having real-time availability of data that can inform decision making, improving production of vaccines and access of vaccines for animals, then also humans, then also improving understanding and rapidly emerging of disease, then improving access to information, dissemination of information, and use of information in One Health and public health responses. Then they also touched on alternative sources where they talked about aquaculture production. And I think when I looked at the graph that's in the article, it was interesting to note, like particularly looking at how it seems underutilized in a lot of regions of the world. Then they talked about a One Health approach uh, to to both animal and human health, and how it's very critical, particularly when it comes to animal protein and the importance of international collaboration, and also looking into various reforms that are affecting access to vaccines and also affect transboundary One Health implementation. And I think when it comes to regulatory processes, I think we were all aware of some of the conversations that happened around COVID-19. So yeah, so in terms of like really the discussion, I just encourage everyone not to limit themselves to the article, because I also find like a lot of things came to mind when I was reading to it, which I'll tap into further in terms of some of the limitations on the narrow focus on protein health and also some of the thoughts around regulations. So this is just a quick overview of the article. But before we open up the discussion, I would like to invite Sharifa. Um, Sharifa, please introduce yourself and you can give us some opening remarks. Thank you.
Hi everyone, so I'm Sharifa Bomashabi. I'm from Benin, currently based in Benin. So I am nutrition and food security specialist, and I will just share a presentation on the topic, especially One Health and food security. Let me know when you can see my screen.
Yes, we can see your screen.
Okay, sounds good. Okay. So I will start with the food security. What is food security? I guess from this panel for everyone participating, we don't all have the same background. So in nutrition or food security world, when we say food security, it includes 4 components, meaning the availability of foods in sufficient quantity, the good quality available from domestic production, from commercial import, from food assistance, or any source of quality and quantity food. We also have access, so people should have adequate access appropriately to food. Also stability, that which refer to the availability of food on a longer period. So having the food very available for people in any situation. Also the use of foods. So people have to use the food properly to ensure that they are really using the nutrients included in this food. So as you know, different kind of foods contain important to use the foods according to 4 components mainly include in the food safe a coexist with for everyone at all time, physically, economically, and that everyone have access to sufficient, safe, nutritious food that meet the dietary needs and food preference for an active and healthy life. So it is important to keep this in mind for the coming presentation. So what are then the major driver of food insecurity? Actually, we have many conflictual contexts in the world which affect food security. We have climate variability and extremes. We have economic slowdown. We have poverty and economical inequality. We also have the unaffordability of healthy diets in different communities. So coming back to the One Health approach, which we will also be discussing, actually the One Health approach is defined as collaborative, multisectoral, and transdisciplinary approach, which aim at achieving optimal health outcome by recognizing the interconnectedness between human, animal, plant, and the environment they share. So on the right side, you can see how all these are connected with coordination, communication, and collaboration between all these kind of health, human, animal, plant, environment, and health. So then what are the main focus area of the One Health approach? These include the prevention of outbreak of zoonotic disease in animal and people, improve of food safety and security, which we will be discussing, the reduce in antimicrobial resistant infection and improve human and animal health, protect global health security, and protect biodiversity and conservation. Now, what is the link between the One Health and the food security? Actually, we said that food security includes availability of food, quality, quantity of food. So food security actually exemplify the complexity of the One Health approach due to its reliance on sustainable ecosystem, which include agriculture and healthy population. So for the sustainable ecosystem, the healthy ecosystem actually provide essential services which are vital for agricultural production. So if we want to have sustainable foods, available food for communities, it is important to have a good agricultural productivity because food comes from agriculture. Unfortunately, climate change, deforestation, and soil degradation reduce the food availability and food quantity, food quality for people, and then affect the food security according to the definition of food security I just presented. So coming to the resilient agriculture, crop, livestock, which are part of the One Health approach, are heavily influenced by environmental factors and zoonotic diseases outbreak. Agroecologic and integrate pest management to demonstrate how the One Health principle can promote sustainability and productivity. So, as I mentioned, crop can also affect food insecurity with limited access, so availability of crop and livestock, also availability of good quality of crop and livestock for consumption. So, coming back to the healthy population, One Health can also lead to malnutrition and poor dietary diversity, which can affect human health and economical resilience in communities. Also, it is important to protect agricultural workers who are those actually producing food in different communities, making it available for people, and then also reduce foodborne illness, which can help to improve food production and public health outcomes. For the public health outcomes, we have different health risks associated with food security, and food security have challenges at the human, animal, and environmental level. These include mainly the foodborne illness that we all know. For example, contamination of food with different pathogen, chemical, or toxin, which directly affect human health and then also affect the food security. Remember, I said that food security include the quality of food. So foodborne illness creates unsafe food for people, for communities, for their consumption. We also have zoonotic diseases, which mainly come from animals, from animal to human, and can also be transmitted from human to animal. But in this case, it's
What is
mainly
out? Like I'm going to turn on my earphones.
sorry, can you hear me? I think someone have his mic open. Okay. So, zoonotic diseases actually account for 60% of all non-infection globally, and a significant portion of these pathogens come from wildlife. With this zoonotic disease, we have many as rabies, we have the coronavirus, COVID-19, that we have been struggling with for about 4 years now. And this actually affects, as I was saying, they affect animal health, they affect human health. Animal health, which are actually destined for consumption, then also reduce the quality of food, the quality of meat destined to consumption, and also reduce the availability of good food for communities. So people who depend on livestock as the main source of consumption, the main source of income, are becoming affected by the One Health approach, by the One Health in general. So the One Health also include the AMR, the antimicrobial resistance, as the misuse of antibiotics in food production can contribute to the emergence of drug-resistant pathogens in human health. So also in this case, it's affect the food security, as the quality of foods is not of the food by human consuming this food can be affected by the One Health. Climate change impact, which is actually everywhere. So for the climate change impact on global food security, it's come from the rising temperature, from climate change, the loss of biodiversity from climate change, which actually affect the food production, then reduce the food availability for communities. Also increase the cost of different food, limited then the access of food, the access to food from different population. We also have the sea level rise, which also affects lands, also affect the availability of fish for consumption. We also have the food distribution challenges, because with the extreme weather, it's actually difficult to have food easily distributed in communities in the different markets. Tracy, can you please mute? Thank you. So I was saying, for the food distribution, it is also affected by the climate change impact, which actually affects the cost of food on different markets, the access to this food, also the availability of this food on the different markets. So I just presented the One Health, the food security, and how the One Health can actually create challenges to reach the food security in different communities. Thank you. Tinashe, over to you.
Thank you so much, Sharifa, for the presentation. And yeah, thank you. And I'll just open up the conversation to everyone to share their thoughts around the topic. Yep. I think for me, so far, what's really coming up a lot is the importance of the multi-sectoral approach that's really emphasized by in One Health approach when trying to really look at some of the key health challenges that we are facing, or particularly and not to look at things in isolation. Like as always, as you know, like in a lot of countries, you'd find most departments, they really have spaces where they can collaborate with the Ministry of Agriculture, Ministry of Health, and also Ministry of Environment, really looking into wildlife. And and when looking at particularly the rhinopus, which was eradicated, thankfully, you look at it, only not only did not affect cows, it also affected some of the wildlife that are there. So you're looking at the far-reaching impact that it has, and not only on domesticated animals, but the but also in terms of the wildlife that are there. And so there's really need for us to have a more integrated approach and invest in more integrated approach from disease surveillance and also being able to respond to that. And I think another thing that also came to mind when I was reading the article and also really thinking about the topic also is the over reliance on a few food sources and the impact of that particular over reliance on even biodiversity, because it promotes monoculture, it promotes agricultural processes that end up using lots of land to really really be it invest in those particular lifestyles, of which I think with diversifying our sources of protein and also our sources of various nutrients, I think it can help in improving biodiversity, because it means that there's now like less demand for one particular species, and I think can also allow our ecosystems to recover. But yeah, those are some of the things that came to mind. But looking forward to hearing your thoughts. And for those who joined, my name is Tinashe Koronga. I'm based in Zimbabwe, and feel free before you contribute to introduce yourself so that we all know each other. Thank you, and thank you so much, Sharifa, for your wonderful presentation. We'll also share with everyone the presentation after the session.
Anytime, Tinashe.
And if you have a question, please feel free to share any questions, because I'm already seeing there are a couple of people that I know on the space that are quite experts on the topic. And I know they always have insightful contribution. Then if you know some approaches that are already being done in your country, that would be great to know too, because I think it's an opportunity to learn. It's always great to showcase some of the interventions or ways that are being done in different spaces and communities. Yes, you can go ahead, Julia. Thank you. You are muted. Sorry, Julia.
Sorry, technology is failing me. Good evening. My name is Julia Tabire. My area of, well, call it expertise or knowledge is food and nutrition. Um, I'm just wondering, I don't know, there's need maybe to segment the world into because I'm wondering why this narrow focus in terms of animal sources. In this part of the world, we also eat insects, and they've been shown to be really have good quality protein. I think there's a danger of applying a kind of a one size fits all. I know it's easier for comparison if we are comparing goats, in Guyana, goats in Uganda and Zimbabwe and so on. But I think we have to take into account the much broader, diverse sources of animal sources of protein that each of our regions have, which have somehow not been discounted, and a lot of them, some of them are in danger of disappearing, but they actually can can fill in an important gap. So I'm just wondering if there's space for, because when you look at even animal consumption, animal protein consumption, most of our countries, we have a challenge even getting good quality protein into the young children. I mean, the availability, access issues, and so on. And so, yes, the other world is over consuming. And then you have another world that is under consuming, certain age groups. So, and there's need to kind of acknowledge that difference and say, okay, what do we do about those that still need it? So what kind should it be? Maybe we should be looking at the sources that are less diseased, but also let's just put all the sources on the table, which we have. I don't know, I'm just putting that out there. It's a kind of I don't have the answers, but I just think we need to broaden the sources, because that's the reality. Sorry, I don't know if I'm having connectivity challenges, so I don't know whether people heard me or not.
I
You're
heard you, and I
clear.
think other people heard you. Yeah. So yeah, feel free to comment. I think that's an incredible comment, and I think an area that I felt like that's missing in the conversation. I think it also speaks to the issue of food cultures and how a
Mhm.
lot of like the dominant food cultures that have come up in colonial times and the neglect of a lot of indigenous food cultures that are there. And yeah, I'd love to hear like more comments from everyone. Thank you. And feel free to just unmute and speak. Um,
Yeah, I'm Pantaleon. I'm calling from Dar es Salaam. Um, Echoing on to the previous speaker, I think this is Julia. My concern in terms of improving food security at country level, I think it's a matter of putting up the policies and the plans absolutely clear, with clear indicators and targeting on how they are going to, as a particular country has to make sure that the issues of food security is adequate and well planned and monitored. I'm speaking this from the perspective of monitoring, evaluation, learning. What do we learn from our plans, from our policies at national level, but as well as at international level when we compare, for instance, between different blocks, East Africa and West Africa, America and Africa, Europe and Asia, issues of food security, which are the common plans and policies that we can make use, even by borrowing from other successful countries which have managed to settle the issues of food insecurity. So we need to have plans which are measurable. We need to have plans which are fully guided by indicators, the KPIs, which key performance indicators will be being used to track and report issues of food security as well as insecurity. That is my views at the moment. Thank you.
yeah, thank you a lot. And I think that's very important. Policy is quite important in terms of really guiding like particularly national strategies. I know a lot of countries, some countries are coming up with strategies around food security, and as a way of trying to promote that. And I know even in Zimbabwe, some are coming up with initiatives to try and promote some of the indigenous sources of food. And coming back to Julia's earlier comment around even some of the nutritional needs um for children, you'd find, because I think sometimes because of the fixation on limited sources of protein, some people miss out on opportunities of some of the protein sources that are readily available, that are affordable, that may that are available, really available, then they end up sometimes really focusing more on some of the expensive sources that they cannot afford, resulting in inadequate access to protein when there are some which are really available in the environment. So thank you so much for the contributions.
Thank you.
And yeah, any other thoughts, experiences, reflections on even like the ongoing conversation around food options and yes, go ahead, Renee. You can feel free to share your thoughts. Thank you.
Thanks. Hi, everybody. I'm Renee Lowenson, Zimbabwean Training and Research Support Center. It's really great to see some people in the room that I haven't seen for years. So nice space to be in. So mine is kind of a reaction to the paper, because when I read it, I just felt like perhaps I'm resonating a bit of what Julia says. It's just a lens that comes from a particular part of the world that I couldn't relate to at all. The paper is sort of attributing food insecurity to population growth, but I think it completely discounts the inequalities that exist between population and food. And a lot of those inequalities arising out of commercial determinants around the way our economic systems are actually extracting food from certain parts of the world to feed other parts of the world, and also are importing or sending into countries foods that are of poorer quality, things like ultra-processed foods, that are actually displacing healthier local foods. So I think the paper is completely ignoring this political economy, and as a result, discounting the points that Julia raised about the foods, but I think even worse than that, implying that somehow there's a technological fix. There was a kind of an admiration of the Green Revolution, but this technological fix that's been spoken about is actually decimating seed stocks, important seed stocks that are the basis of indigenous foods, and discounting the kind of whole way in which land is being moved away from small farmers, female farmers, the basis of food security, towards large monocropping with adverse effects both on antimicrobial resistance and other zoonoses. So the analysis was completely, for me, lacking in a proper political economy. And in that respect, I think other parts of the world need to speak up about what actually is the basis of food security. It felt to me like a very Northern Hemisphere perspective. Having said that, I think we do have to have a lot more focus on these commercial determinants of food insecurity, and particularly when we're talking about climate, because I think the trade agreements and the ways that financial flows are being managed are making the whole climate impact even worse, are creating zones of vulnerability that are exacerbating the climate impacts, whether it be for small-scale farmers and so on. So the link between these drivers, these commercial drivers of food insecurity, for me, have to have a much greater focus in any discussions like this. And we need to be very cautious about technological fixes that make farmers dependent on technologies that are not indigenous, that are not local, because they become expensive, they immiserate, they indebt, and they also create cycles of dependency on large corporates, and therefore make us more susceptible to what these corporates are pursuing, including in international trade agreements. So I wanted to throw that in because I think we need to contextualize the discussion about why we are moving away from indigenous foods. and what is actually going on within our countries that are generating food insecurity. And on that, some of the biggest areas of food insecurity, of rising malnutrition, are actually in food producing zones in our countries. And it's because we are exporting. We now, we sell what we don't eat and eat what we have buy. This economic system is generating high levels of malnutrition, which also make people very vulnerable to zoonotics as well as to climate change. So I'll pause there. Thanks for the opportunity and really interesting conversation.
Thank you so much. And yeah, I agree in terms of, I think reading the paper, like those limitations were really coming to mind, and even some of the recommendations around the focus on, like the focus was, it should be led by international, uh, the recommendation is that it should be led by international organizations. And, yeah, I completely agree around that. When you were speaking around the commercial determinants of health, I just remembered one day I was talking to my grandmother. I asked her what she used to eat growing up. Then she smiled and she told me about how growing up they didn't buy most of their food. She'd talk about like spending some time as kids playing, eating uh, like available fruits, and they would forage for different vegetables. She listed a lot of plants that they used to eat. But now, if you look at in a lot of urban areas, particularly in Zimbabwe, you can predict what people are going to have for supper and what's being sold on the market. And even right now, you start noticing a lot in terms of how the market is influencing dietary choices and options in terms of the marketing that are there, and also eventually creating a lot of food deserts sometimes in some spaces. And you really touched an important point around land, which I think the previous conversation that I hope people would encourage everyone to reach out to Renee and get a recording on an important conversation that happened earlier around issues of land rights and land ownership and its impact on, yeah, on food security and also issues and the connections to climate change. Thank you so much for that. Looking forward to hearing more contributions and reactions. Nightingale just shared in the chat about how Ash totally agrees with Renee about the idea of having seed controlled by select few start with a horrible idea, and that seems to be taking over the planet. Patenting of seed production by those who still indigenous food production knowledge is a serious issue as well. It is also a global north and a global south issue as well. Yeah, I would love to hear if Nightingale, if you're in a position to speak, would love to hear more about your like expansion on your point, and also totally agree with that. And everyone else, feel free to share. It would also be nice to hear about food practices in different parts of the continent, since we have people from different regions and how they also relate to this topic. That's okay, Nightingale. Yeah. Any thoughts? Sherifa, others, Samuel, tonight, anything in terms of your own experiences and some of the conversations you'll be having. Yes, go ahead, Julia.
I'm not an expert in nutrition. Okay, go ahead, please, Julia. You can go ahead.
No, I pressed by mistake. I wasn't I was trying to read the chat.
Okay. Anyway, I think my question will be addressed by yourself. Like, I was just trying to drop a thought here, like, are we obliged to rely on animal sources of proteins? Why don't we just go back to nature and uh, find more or best source of proteins? I think I went over some resources the last time, and they were saying that vegetables and natural sources of protein were the best one uh, compared to the animal one. So I think I will need your point of view regarding those aspects. Thank you.
Thank you. Go ahead, Sharifa.
Yeah, thank you. So, just to quickly reply to you, Amy. So, that's true. As you said, we are not obliged to only use animal origin proteins, but at some point, as we are talking about a multi-sectoral approach, which is One Health. Unfortunately, the crop may also be contaminated, may also be from poor quality. And just to give you an example, a study has been conducted in Benin, especially Cotonou, and this study showed that the water people have been drinking in you are also based here in Benin. So this water was not like of good quality. So it still affects the quality of, so it's not only about the animal from anywhere. So yeah, and this exists everywhere, not only in Benin. We have this issue almost everywhere, like contaminated soil for crop production, unsafe water for drinking. So yeah, just to give you this information I have like from Benin experience, especially.
Yeah, thank you, Sharifa. You really brought in an important point in terms of even looking into sustainable farming methods for the production of the vegetable sources. And I think it also ties into what Renee talked earlier about how about like how like the in terms of when the commercial determinants of health and around how like some of the need for seed banks and some of the like we are now having some of the corporations patenting seed, like Ceres Nightingale mentioned even in the chat, which is of affecting like a lot of some of the indigenous seeds and indigenous sources. So it's really important to have that critical lens um, around like overall sustainability, regardless of the source. And even like the implications of just relying on animals in terms of, particularly in the global north, the contributions of that to emissions, which is why, like, if you notice, particularly in a lot of Western countries, there is now a push for cutting on meat consumption and really eating more of vegetables, of which, when you really think about context again, you'd find that in some communities already, vegetables and other like plant-based protein uh well is contributing a lot to sources of protein in different processes. Then I think to what Julia also mentioned again, when you really thinking around alternative sources, I think another issue that has happened is there've been a lot of cultural influence in terms of which food is looks nice and appealing. Like if you're watching commercials that are there, like the boom of big franchises and companies, particularly in the fast food that are coming in, and how they market their food, how they package their food. So you then people end up shunning their own like local foods in preference for that. So, so I think some of the recommendations that are coming to mind is really emphasizing, really looking into the commercial terms of the mentioned area, and also trying to start addressing some of the narratives that have been dominant, that are resulting in a narrow focus in terms of some of the in more and reliance on unsustainable sources of food. Go ahead, Sharifa. Thank you.
Yeah, thank you, Tinashe. I totally agree with you. I just wanted also to add that it is true that when we say food security, we think obviously about food availability, food safety. Just have food. They just eat to fill their stomach. But there is the upcoming health issue associated with this kind of different food we're having. Like for example, we can have like diarrhea. Pregnant women can also be affected by the kind of food like they are eating with all this contamination. I just wanted to point this out that it won't only be limited to the food, but also the upcoming health risks associated to the different kind of food that we usually eat. So not only focusing on just fill our stomach, and yeah, that's all. Thank you.
Yeah, thank you. So we're left with about 7 minutes on the call. Um, any more recommendations, comments, and final remarks before we ask for suggestions on the focus for the next session? Yeah, go ahead, Renee.
Thanks. I just want to throw in something which is that based on some of the work that we've been doing in East and Southern Africa, which is there is this traditional view that the rural areas produce food and the urban areas consume food. But I think the COVID pandemic really has exposed that this isn't the case, that urban areas are growing food. And also we know that, for example, in East and Southern Africa, there's a high degree of urban agriculture taking place. And one of the things that we've been involved with exposing, documenting, and sharing is this link between urban food systems, urban waste management, urban clean energy and bioenergy, and a kind of a circular economy between these systems where waste where waste processing can help in creating organic fertilizers for urban food, but also clearing up urban land for urban food production, which generates income, which also creates opportunities through processing waste for clean energy, for refrigerating food markets, vendor food markets. So I think when we are thinking about food systems, we are thinking about them in the context, particularly relating to climate, of circular economies that make connections across these different elements of what contributes to health. And maybe we need to think about One Health not only as a sort of relationship between animal health and human health, but also as a relationship between the different systems that create economic value from these different areas. I think there's lots of work going on in our region that exposes this, but the policies and laws are somewhat lagging. They haven't quite caught up to the practices. And the pandemic has shown us that actually these practices have generated resilience on the ground to these zoonotic pandemics. So I just want to throw that in because I think we've been largely focusing on rural-based food production and urban consumption, but I think this is not a reflection of what's going on in our cities either.
Thank you so much, Rene, for that. And if you have any resources, please share them in the chat, so that we also share with everyone. And also, or you can also email them to me, then I can share them with the rest of the group. Go ahead, Nightingale.
Thanks, Tinashe, and thanks for this really good conversation. So I just wanted to maybe say a tiny bit more about my point earlier, and it's really just to say that this is a very political conversation, as it really is. And so we also have to approach it politically as well. And it's like we have to solve it bottom up and top to bottom as well, with policy, reviewing our policies, because like I'm calling from Kenya, and it's been quite a tumultuous time as the policies that are being introduced have really affected the common farmer. And if they are implemented, it would be really bad, because it's where people have to even pay taxes for the animals that they keep, including the pastoralist communities. And so it's that's part of the reason why I'm saying it's very political or politicized. So I think even educating our leaders, our political leaders, is so important, because sometimes, since they're the decision makers, they approach matters, nutrition and food security from, from sometimes a personal benefit approach. So, and this ends up affecting both the farmers and the local communities who mostly depend on these foods. Also looking at the people who are funding these food productions as well, I think is going to be important. We see a lot of the funds actually are external, and they come packaged in a way that dictates how we grow our food, produce our food, and store our seeds. So yeah, I just wanted to touch on that, but also to say that climate change isn't also helping. And so we have to review how we have maybe farmed in the past. But I also think that we are not borrowing enough from the traditional indigenous food producers, people who have done this for millennia, who have still witnessed climatic changes, maybe in smaller, it wasn't as extreme probably, but there's a lot of knowledge housed in these traditional indigenous ways of knowing. And now, because we have the newer ways of knowing, we could call it the modern ways, forgetting these old ways of knowing, I think, is part of the problem. And so I know somebody else touched on the indigenous, and I just wanted to second that and say we cannot forget these people as we come up with the solutions, because a lot of the solutions might lie with those communities as well.
Thank you so much. Thank you so much for that. And I think that the point of policy also came up in terms of one policy not catching up to, then also at the same time some policy having some causing more problems and causing more harm in that. So thank you so much for those contributions around and the connections that are happening in terms of the different contributions they were quite powerful. So in the interest of time, I'm noticing that we are on the hour. So is there anyone who has like any suggestions in terms of um on what the what suggestions for a topic for next week? Uh, feel free. Sorry, not for next week, for the next session, and feel free to also email some of the suggestions around that. So, any suggestions for the next topic one, and the second thing is any final burning comments and questions. Go ahead, Mike.
All right, thank you very much. My name is Mike Mwale, and I'm a monitoring and evaluation specialist. I think maybe just a comment. I think there was great submissions from the people here on the call. I think maybe my comment would be around data with regards to the One Health and also the food security. I think we may need to strengthen our data so that it's easy for us even to advocate the connection between the human health as well as the animal health. We just maybe need to strengthen on how we communicate these connections using data, so that even as we speak to these different stakeholders or policymakers, there is evidence that there is actually that impact that is affecting the food availability in these communities. So coming from a data background, I would really love to see more data around this connection between the animal health as well as the human health, and also how it actually impacts the food security. Thank you. That was just my brief contribution on that.
Thank you, Mike, and you can go ahead, Sharifa.
Yeah, just to tell Mike, thank you, and I will share some data with you. I will make sure Tina should share data with everybody on this call.
Thank you.
All right, thank you. So if you have any resources, please share them with me. Then I'll share with everyone else. And if you have any thoughts again in terms of the discussions, please do. So yeah, so I think just a quick wrap up. Thank you so much for making time to join this conversation. And I think we can all agree that we really learned a lot in terms of um uh, a lot of issues came up around commercial determinants of health, the role of policy, the importance to really think the dangers of really being fixating or looking at the global north narrative that also that it doesn't include some of the aspects that are in different parts of the world, and and yeah, and the need for data to inform policies and research. So those are quite important. So I'll also like share quick summaries with everyone, and we have registered for the poll, including some of the resources that we have shared. And I also encourage people to to really explore, to continue this conversation even offline. We do have a Google group. You can email me to you can email me if you'd like to join. And we really hope that these conversations uh will not just will not only build capacity, but we hope they will also stimulate more collaboration and continue informing some of your work that you are doing in different parts of the world. So Julia, you are unmuting. Do you have any final remarks? Then we call it a day. Thank you. All right, that's okay. Maybe it could be tech issue. So thank you so much, and thank you for staying 4 more minutes over time. And also, please do share with us suggestions, and also in terms of how we can improve the conversations that are there. As I mentioned, the aim of this space is to promote peer learning and contributions in a lot of these topics where we are at different levels of expertise and understanding, with the hope eventually that it will motivate us to work to collaborate more in different sectors, and it also inform us our decisions in different spaces that we work in. So thank you so much for making time, and have a good morning, have a good afternoon, and have a good evening, depending on where you are calling from. Thank you.
Thank you.
And
Bye-bye.
please don't forget to share the resources so that I share with everyone else.
We'll do that. Thank you, Tinashe. Thank you, everyone. Bye-bye.